This episode of MarbleCast is brought to you by Marble Weightlifting Online Program. Our programs are run through Train Heroic. It's a simple, easy-to-use app for all of our athletes to track progress while providing top customer support. From our Olympic weightlifters to our fit body boot campers, our programs are there to keep you motivated and stay on track. So check out the link in the description and get started today.
I think all of us need to be accountable of, now everyone has, in the perfect world, everyone have some type of medical insurance and have a doctor. But I think all of us need to take care of ourselves, like lose some weight, exercise better, eat better. If you have a strong body, there's a high likelihood you will survive the COVID without a problem.
All right, welcome back to another MarbleCast. I'm Joe Marble, your host, and today I got a special guest, Dr. Jose Torres from Queens, New York. What's up, brother?
Well, it's been a long time, man. I haven't seen you since you opened your gym.
I know, man. I miss working out with you.
Well, I miss my coach. I became a lifter, a Ronin lifter with a little bit of remote coaching, and then I just came up with my own coaching, and then lost the battalion lifting, and then I got hurt, tore my rotator cuff completely, and I had to get it fixed. Survived a torn bicep. I feel older at the age of 47.
Oh man, you had a rough road. Yeah, man. Have you been lifting lately? Is everything fixed up, or?
I got surgery. It took like months of rehab. Right now, since I'm a little cautious of going to gyms, because it's no offense, but usually the gyms are a little bit crowded, and I know they try to limit how many people are there, but I've just been using a sandbag, throwing it around, doing push-ups. Nothing crazy. I was thinking about getting ropes and a hammer to hit a tire, maybe a tire that would pull, and to throw around. But
just keep it simple, man. That's the best way.
I think the best thing is at our age, well, at least my age of 47, just keep moving.
Absolutely. Hey, man, if you need some workouts, we do those at-home CrossFit workouts. You can always watch them on YouTube.
Those sounds exciting.
They're not bad,
just like
actually.
Just like those WODs that had running. Oh.
No, man, these are like quick hits you could do on your own, limited equipment, and they're not too bad. You should check it out.
No problem.
But anyways, man, you are looking pretty good. Say again?
They're like ham, hard as mother.
Yeah, there you go.
Workout. Right?
Well, you're looking good, man, and I miss you. I hope we get to work out soon again. And no offense taken, gyms are, it is what it is. We have to stay in business and do the best we can. So when you're ready to come back.
I think the only way that people will feel more confident going to gyms is showing proof of vaccinations. I'm sorry. I don't think we could wait for everyone to get COVID and then feel immune. I think the whole United States need to be vaccinated to feel comfortable to go into a gym or a park and be around other people closer.
Absolutely, man. I'm all about it. So what is your specialty and where do you work?
So I work at 2 hospitals now. So I work in Flushing, Queens. There's 2 hospitals. I work at the New York Presbyterian Hospital. It used to be called the Old Booth Memorial. I take care of many Asian patients, Korean, Chinese, Hispanic. Anyone who shows up in Queens on the 44 bus or the 7 train can come to my ER. And I work at another place, Kings County, right in Brooklyn. The City Hospital of Brooklyn. So I've seen a lot of COVID as an ER doc. I was there for the first wave. That was a ridiculous wave.
How's it been lately?
All of us in New York are waiting for a possible second wave. It's slowly creeping up, but not the way it was in April and March.
Well, it's been the second wave. Aren't we in the middle of it?
So, so when people are using the data that they're using from like John Hopkins, they're using the data of the entire United States. So when New York got hit, other states only had trickles of COVID. Now the other states are catching up to what we had.
Right.
That makes sense. So basically, all those states that were never affected, now they're catching up.
Right.
So
Yeah. So it's sort of going across the country.
So when people are saying the wave, you have the rest of the 40 states that weren't affected. Just imagine their accumulation of all those people who are finally getting COVID. And that's why they're talking about how we're getting every month or every few weeks we're getting 100,000 more and more patients.
Yeah.
And then of course they're saying, wow, there's at least almost 2,500 to 3,000 deaths. That's the range every day. Remember, there's a population of 300 million people.
Yeah, it's a lot of people.
So
when you're dealing with it, what is I kind of lost my train of thought. My bad. Have you been? Have you contracted it at all? Have you been safe from it the entire time, traveling through all these different hospitals?
I've been safe. I actually had a white suit that they would call a bunny suit. The only thing missing was the ears. I was watching what the Chinese and the Italians were wearing, and we had it bad. There was a time like 95% of all the patients in the emergency room. It ranged from, I think there was one time 150 to 170 patients in my emergency room, and 95% of them all had COVID. All were sucking on oxygen, waiting for a bed. That's how full the emergency room got. And eventually the whole hospital got full of COVID. Imagine almost 400 beds full of all COVID patients.
How has the treatment evolved from like March till now?
So the first treatment has always been oxygen. So the bad thing about COVID, either it makes the diabetic sugars go up to 700, or have people who have mildly problematic kidneys, like kidneys that aren't working well, go with complete kidney failure. And then the most common reason people were getting admitted is they couldn't breathe. So the treatment was oxygen, and trying to use all these treatments that people were proposing, like chloroquine or hydroxychloroquine, there's anti-malarial drugs, zinc, azithromycin. Those things, once you were really, really sick, it was too late. And basically people would either die within a couple of days, a couple of weeks, or over a month, slowly.
So what has been the most effective treatment so far, other than oxygen?
We learned that we can actually push air in your face with certain masks to at least allow the body to recover. To me, the most miraculous thing is the human body.
So just keeping it strong.
Oh, it's amazing. So the sickest people are the people over 80 years old. You're at the age of grandparents.
Yeah.
Those are the ones who had like a 1 out of 4 to 1 out of 5 chance of dying if they had COVID. My mom survived it.
Yeah, good. Good for her. I'm happy.
Like Optical Blue. And this is in the beginning when people were banning doctors and visitors in the hospital.
Right.
So I was not even allowed to see my own mother in another hospital.
Well,
I said I'm a doctor. I'm an ear doctor. No, I was not even allowed.
Yeah, it's wild out there, man.
The only person she was able to talk to was a nurse and the lady cleaning her room.
Jeez.
She said it was like the loneliest 4 to 5 days of her life.
Hey, at least it was only 5 days, right?
4 to 5 days that her oxygen level dropped the lowest, and it slowly creeped up.
All right.
But she got better. So then I've seen people get sick. I've had residents get sick for like 2 weeks and disappear. I'm like, what happened to them?
Yeah.
The other treatments that they had is steroids to get the inflammation down. But I think the most important thing that people need to do, and no one understands this, is to measure your oxygen level. Remember how I recommended you should have an oxygen level?
Yep, I do it every day.
Anyone with COVID, the people who need to worry the most is the oxygen level that starts dropping for no reason to drown.
Well,
So
what would explain the pulse ox meter and explain what works and like what you're looking for when you're taking that pulse ox?
So hopefully you don't have problems with circulation. So some people with bad smoking habits and bad diabetes, they may not have the most accurate measurements of oxygen off the tips of your finger. So the reason our fingers are pink is because of the blood flow that goes through. That machine, the the oxygen monitor that you put on your finger, is that little light, that red light that shines through it, is calculating how much oxygen you're carrying through that fingernail. The one way to always get admitted to the hospital is your oxygen level being lower than usual.
What is usual?
When we got hit, so usually most people have the oxygen level above 95. Now people, when they exert themselves and your oxygen level is starting to get 90 or less, it's already a requirement to be on oxygen, like at least some supplemental oxygen. And the fear is in the next 24 hours or 48 hours, your oxygen level may even drop even further. And you may need to even increase more liters. So you know how we have like liters of soda, liters of water? Imagine having liters of oxygen going through your nose per minute. So it can go from 2 liters to 4 liters, 6 liters, up to 10. And if that's enough, you have to start using a mask of oxygen. And some of these patients, when they came to the hospital, they were having oxygen levels of 50 and 60. And imagine having a tube in your nose, 2 tubes, one small one for each nostril, and having a mask to suck on. And hope that you get better in the next few days. What happened is if you weren't getting better, you would get put on a machine. This ventilator that Mr. Cuomo was talking about and de Blasio was talking about, I don't think we even had enough hospital beds to even if we got all those ventilators, all those patients did badly. At least 80% of the chance of mortality. If you were on a machine from COVID because your oxygen level was that bad and the inflammation is so bad in your lungs, you had an over 85% chance of dying.
So with that ventilator, would you say that that's like just a last resort to keep somebody comfortable, or is it just like a Hail Mary pass?
At that time, they didn't know what to do because the lungs would fill up with such much inflammation that we would hope we would overcome the inflammation. Usually, when a person has a pneumonia and you get your antibiotics, maybe in 2 and 3 days, the pneumonia, all the pus in the lungs clears up, you get better. But this disease was more of an inflammation type disease. Like it would attack the cells of the lungs to a point that some people would even need a lung transplant. That's how bad the lungs would get. Or people who do triathlons, don't work out, who are like natural athletes, the ones I hate, the ones who could run a mile with no problem and swim, all of a sudden they're like short of breath walking around the hospital. That's how bad the effects of their lungs are. And we don't even know the permanent sequelae, like what's going to be the permanent results of COVID on their lungs in the future. So the ventilator is a last resort, and it truly became a last resort when we started to see people just dying, either quickly in a couple of days, or imagine having an agonizing, lonely death over weeks to months on a machine, and not having any visitors, because the disease is so contagious that only people who were taking care of the patient were allowed to see the patient.
Yeah.
Lonely death. Sad death.
Yeah, definitely. I definitely feel bad for anybody that had to deal with this. It's definitely not a...
So some of the treatments they've been trying to propose is getting the blood of people who have survived COVID and use whatever circulating in their blood to protect you. That hasn't worked much. Some people say it works. Some people say that they're antibodies that build defenses, that people find antibodies to attack certain parts of the virus, and that works. But almost all these drugs that they're pushing are expensive.
Right.
And none of them have been proven to be a cure.
So what do you think about these vaccines that are coming out now?
So today I just got one.
Oh, good.
So I didn't swell up. I didn't get itchy. I didn't fall down and collapse and die. The next step is I'm waiting to turn to a zombie, like in World War Z. And my family has permission to kill me. But I don't think that's going to happen. Or I'm going to look for Will Smith and I Am Legend to find a cure.
Just camp out.
But right now, I'm just telling you that if I don't get vaccinated, I still have a chance of getting the disease. Now, from one of the data points, they said if you got the 2 vaccines over 3 weeks, 3 weeks apart, 95% chance of me not getting the disease. That's better than what I have right now. All I have is a mask and a shield over my eyes and gloves to prevent me from washing my hands. That's all I had to protect myself from getting COVID and bring it to my family and my friends.
Well, thank God it's been working so far.
Either that or I have the good gene. So I think this is a disease that we're not going to know much of. We're going to learn more and more about this disease over years. Because if it takes this long to get a vaccine, if it took that fast to get a vaccine, it's not a normal disease. This is not a disease that's going to go away. I don't think it's going to go away in 1 month or 2 months. Everyone was hoping for that. Yeah. I think this may become a yearly thing like the flu.
It could be.
So I'm going to tell you straight up. If I haven't died, having no bad side effects happen to me, and I'm a doctor, I think people who aren't doctors should have faith in that. I'm not getting paid for it. I don't get a microchip into my arm. The government can't track me.
Well, they can track you, but not through the vaccine, probably through your phone and everything else that we do.
Yeah, through the phone, but that's my fault.
Yeah.
That's through, I follow Instagram, and Facebook probably gives information to the government, but that's on me. But I think if I survive, and people like to call us heroes, I just do my job. Think about it. And I have pride in my job, so I want to be alive to do it. I'm pretty good at it.
And thank you.
So I don't want you to be sick. I don't want anyone who I care about to get sick.
Yeah.
And it's not politics. People need to get rid of that shit. Do not follow. It's not politics. It's science.
Well, I think some of the politicians just took advantage of certain situations, and it made it extra weird for everybody since we're all just stuck in the middle. But let's leave that aside.
Yeah. So my opinion is I'm not forcing anyone to get vaccinated. If my wife gets a chance or my kids get a chance to get vaccinated, I welcome it. The reason I'm encouraging the vaccines is if everyone gets vaccinated, you can open up the businesses. We have to open up our economy. I feel bad for all the people who are going to get evicted. They've been freezing these evictions, but no one has said anything about owing the landlords. People are going to lose their homes.
Yep. It's going to be a really long road to recovery from all this.
Economic-wise, the people who are going to take a while to recover, post-traumatic stress of seeing people die. I've seen many people die. I had to separate myself from the family, just go into the basement or stay in the car for a long time after my shifts.
Yeah, I can imagine. So
I've seen death.
Let me ask you a question.
Mm-hmm.
If you had a magic wand and you could do something different from the start, what would you have done, or what do you think could have done?
I think the biggest problem that we have here is we don't truly share information with China and Italy well. They were telling us certain things and we did not listen. As Americans, no matter what was being published by those doctors, we did not listen. I think we should have worn masks sooner. And I'm sorry if everyone thinks it's an intrusion of freedom. I'm sorry. Wearing masks should have been encouraged right off the bat. The vaccine, I'm sorry, it's almost miraculously with science that we've gotten a vaccine this fast.
Well, I heard that the vaccine was made in January and had to just be put through tests from there.
So the problem is, you never want to give a vaccine that kills people, right?
Right.
So a while back, Russia was saying that they had no COVID, and then they were the earliest one, 4 or 5 months ago, said that they had a vaccine, and despite that fact, the numbers climbed. So whatever vaccine they were using wasn't working. So. And even these countries like Japan and South Korea that thought they were smarter than everyone else, it's spreading again in those countries. So it's a contagious disease that you would think goes away with the summer. It never went away. It just festered.
Yeah, it just died down a little bit.
And I think the scary part about the disease is there are people, I think, are super carriers. I think there are people who carry their disease and they don't get sick. And they don't even know that they have the disease. And they could just spread it to 5, 10, 20. I think there was a case of a guy going to a wedding. All 150 or 70 people in that wedding got sick got COVID because of one person.
Now, does that happen because the person doesn't know how are they supposed to know that they're carrying it? So that's one issue. But when a whole family or a whole group gets it, is that more of like a genetic thing, or is that something that this disease just does and it's just weird like that?
I think it's very sticky. So when they always show
What happened? You there?
show that round ball, little pegs on the outside, that's how sticky the disease is.
Right.
It can stick to the mucosa of your eyes, and it can enter that way. It can enter through your nose or your lips. So that's why they always tell you to wear gloves and wash your hands constantly. I think it's very contagious. Now, I hope this doesn't offend anyone, but I think Hispanics and blacks, those who have hypertension, diabetes, have been hit the most and fastest. It doesn't help when people live on top of each other or living in close proximity. So if it's just two people in one household, people can separate in a house. But all it takes is one person in like a 2-bedroom apartment who has 5 people who live there. It's very easy to get contagious. So I think it's an economic thing that if you can't afford the space, you really can't socially distance in your own residence, in your own apartment. And I do think that a lot of people don't know they have hypertension and diabetes. And I think those two diseases, along with obesity, which is rampant in the United States, you become the perfect victim for COVID. And for some reason, I think we're going to discover, I think some people are genetically just predisposed to getting COVID. I don't know why I haven't gotten COVID other than I protected myself. And maybe I have something in my genetics that prevents me from getting really, really sick. But I don't know, and I don't want to guess wrong and get the COVID real badly. Right? Like this, hopefully I can give more talks to you later on in the future and not die and be sucking on a plastic tube. Right? So that's why I got the vaccine, and I hope I never get COVID.
Yeah, man, I hope so too. I hope everybody stays safe and we get through this in the next few months. Hopefully it sort of dies down and 2021 goes really well.
Right, so, but this year is a very interesting year. It talks about race, police. It's a weird, interesting year.
I agree.
It's not only about COVID, right? It's almost like a self-reflection of our country.
It was almost like a reset. We needed a good reset, but not in this way.
No. And I'm just telling you, we're way luckier than those people in 1918.
Oh, yeah.
Back then, it was medicine. And millions of people died. We at least have some medicines or some oxygen to give you while you're sucking short of breath. I can only imagine how people were dying left and right back then. But the good old days, the good old days.
Yeah, good old days. All right, let me ask you one final question. What can we do as a society or just general people to keep our health and boost our immune system to the best of our ability?
I think all of us need to be accountable now everyone has, in a perfect world, everyone have some type of medical insurance and have a doctor. But I think all of us need to take care of ourselves, like lose some weight, exercise better, eat better. If you have a strong body, there's a high likelihood you will survive the COVID without a problem. If you have a weak body, not weak soul, we're not talking about your emotions. We're talking about if you have a weak body, like immune system is down, you're going to get run over by COVID. So eat well, exercise, move. Moving shouldn't be with the fingers only. It should be with your legs. Take a walk. But until we all get vaccinated, wear masks. And some people feel like they get suffocated. If I can wear a mask for 8 to 12 hours in a shift, I don't collapse, and I do it 4 days in a row, I think the least you can do is wear a mask when you're in public. And people still walk around like, yeah, whatever. I'm like, if I wear a mask, it's to protect you from me giving you COVID. And theoretically, and if you wear a mask, it's for you not to give me your COVID. That makes sense?
Absolutely.
I think people should need to look out for each other more. And I think, unfortunately, we're a selfish society.
I think all humans are selfish by nature, and it is what it is. But we group and we tribe together as best we can. So
the only thing you can do is group with the people you love and that you trust. And hopefully people can change their mind, become more humane, and look out for each other.
We all have to do our part.
Mm-hmm.
All right, brother, we got to wrap this one up. Thank you so much for talking with me today. I appreciate it, and it's good to see you.
Likewise, man.
Hopefully we can get together next year and get some workouts in.
Oh, yeah. I think I still know how to do a clean and a snatch. I don't like the snatch well, and I can still squat a bit. I still have flexibility.
I think I'm still trying to catch your squat, so I'll keep at it.
I think you caught up with me, but I think I'll catch up to you.
Yeah, you still got it. All right, man. Thank you for being on this with me. I appreciate it. All right, guys. I've been your host, man. Joe Marble, and I was here with Dr. Jose Torres. He's in New York fighting the good fight for COVID. We appreciate it. Thank you, sir. Thank you for watching. Age is inevitable. Weakness is not. So get out there and live some shit. We'll see you next time. Thank you for listening.
Bye, guys.